Our program will begin shortly, but we do ask that you begin to make your way in to fill in some of the seats. We're excited to make our announcement, and we're so thankful that you're able to join us today. We'll get started in just a few moments. Thanks, everyone.
Hi, good afternoon. Thank you so much for being here. It's so great to see so many familiar faces and see so many new faces. Our program will begin momentarily. I still see a few more seats that are available. So as we say at church, scoot over some. You can let someone sit next to you if you have an empty seat next to you. And we will move towards our event and our announcement in just a few moments. Thanks, everyone. All right. Good afternoon, good afternoon, good afternoon. Thank you for being here. We still have a few seats up to the front, so you can come on up to the front, make your way to a seat. Here's the catch. It's a little bit cooler the closer that you come up, so more incentive to sit in some of the front rows. Good afternoon, everyone. All right. This is an exciting day. If you are sharing pictures from our event today, and we encourage you to share pictures, we just ask that you tag Norton Children's because we want everyone to know about our announcement today. I'm going to turn your attention to a video in just a moment, but after the video, you're going to hear from our president and CEO, Russ Cox. And he will share the important news, and you will hear from several supporters today to really share this vision of what we are talking about. So at this time, I do ask that you turn your attention to the monitors to take a look at our video as we explore where are we going.
Do you know what I love most about being a kid? We believe anything is possible. We dream the biggest dreams and have the biggest hearts. That's why we deserve care that helps us soar. Kids like me dream about doing big things like being dancers, scientists, superheroes. But to get there, we need to feel our best. Norton Children's is growing, with more special buildings, special medicine, and really special people caring just for kids like me. This isn't just a dream for kids, it's a dream for all of us. Now more than ever, it's time to believe in kids, to care for kids, and to build something amazing together. When you do that, when you give us a chance to rise, there's nothing we can't reach.
Well, as you just heard the question in the video, where do we go from here? Well, I'm about to tell you. What an incredible day. I have goosebumps in this kind of temperature. It's amazing. I see people walking across this field. I feel like it's Field of Dreams. We will build it, and they will come. So, there are so many special guests with us today. I can't tell you, it was wonderful to see you interacting with each other. And it's good to be surrounded by so many people who care so deeply about children in our community. We've got so many people who fit that description today. And children like Lily right here in the front row and her incredible family who's seen the impact and actually can help you understand the impact that a children's hospital can make. And I can't wait to hear from you. You're going to hear from her family coming up. Gosh, I want to thank the Board of Trustees of Norton Healthcare and the Norton Healthcare Foundation. We keep coming up with ideas and you keep saying yes. And we absolutely appreciate you being here today. Our chair, Craig Grant's here. Our former chair, Edie Nixon's here. So much has happened under your leadership. Let's give them a round of applause, if you would. I want to also recognize those who are here representing Senators McConnell and Paul and Congressman Guthrie and McGarty. If you raise your hand or stand up, thank you all. You know, as CEO of Norton Healthcare, I've had the privilege of seeing so many major milestones and witnessing so many great things and breakthrough moments. And it's when our community comes together and makes something bigger than us as individuals, but comes together to make it work together. You know, increasing access to care is what we're called to do. And by golly, it's what we've done at Norton Healthcare. Hopefully, you saw that in this community when we recently opened Norton West Louisville Hospital. Are you ready? The first hospital to be built west of 9th Street in more than 150 years. That's right. I'm going to be saying that in every speech I give for a long time because it is about access. And we're here now for one of the most significant and defining moments in the history of pediatric care in this region. Because today, we're here to share a bold vision, one that's going to impact the lives of children not only in Jefferson County, but across Kentucky, Southern Indiana, and far beyond for generations to come. You know, we're building on a vision of Mary LaFawn, who was so critical to Norton Children's Hospital years ago. Before the Louisville tornado outbreak of 1890, Mary played a crucial role in establishing children as individuals with rights and envisioned a hospital that she termed was just for kids. Children's Free Hospital opened in 1892 and would later go on to become Norton Children's Hospital. Now, over the past 133 years, Norton Children's has been part of this community, has been part of significant medical moments in Kentucky history. Not everybody knows we provided care and hope during the 1937 flood, and again after the Carrollton bus crash of 1988. We helped lead the charge during the polio epidemic. Not many people know this. We're the second hospital in the country to perform a pediatric heart transplant. So as you can imagine, we're extremely proud of our history, but it's time to build a new legacy. Today, I'm proud to officially announce the development of a second dedicated pediatric hospital to be built on this very field where we sit and stand. You know, this isn't just another building. This is a once-in-a-generation opportunity to reimagine how we deliver care to children and families. This hospital is going to be a full-service facility that'll include an emergency department, surgical suites, diagnostics, and subspecialty care. Now, let's talk about something too overlooked: behavioral health. More children than ever are facing anxiety, depression, trauma, and other mental health challenges. We will invest in child and adolescent behavioral health services that are integrated, that are accessible, and compassionate, because healing's not just about the body. It's about the mind and the heart too, and especially when you talk about our youngest patients. This hospital will be part of the first phase of a new Norton Children's Pediatric Medical Campus. Think of this as a village where barriers are broken, where care is transformed, and where families have everything they need while their child is being cared for. We're going to be designing a space that spans more than 150 acres, that recognizes children should never face illness alone. Families are part of every diagnosis, and they need to be part of every recovery. This map shows you what the campus could look like once complete. In addition to the new pediatric hospital, a newly designed space for advanced research will be on this campus. An innovative building to support our academic partnership with the University of Louisville School of Medicine, and enough space to make sure a family's needs are met while their child is with us at Norton Children's. This will be a place for the whole family, with spaces and services that meet emotional, mental, and physical needs. I promise you, it's going to be a state-of-the-art, multidisciplinary destination for pediatric care, unlike anything Kentucky or this region has ever seen. Take a look at what we're talking about. These images show what this village could look and feel like. It's going to be a walkable community where you can park and never have to leave the campus if you don't want to. With the scenic green space maintained, this will be a healing environment with views of nature. Natural light is part of the healing process. Boy, did we learn that with Norton West Louisville Hospital. It's so important. And we know the importance of floor-to-ceiling windows in the care setting. This village, if you will, of care will unite the most advanced medical technology with the top minds in pediatric medicine and deeply compassionate family-centered services, all right here in one place. And it's going to serve everyone. Whether your child is from J-Town right here or whether they're from Juneau, Alaska, this campus will answer that phone call and we'll take care of your child. We envision this as a national destination for pediatric research, where groundbreaking discoveries happen and new therapies can be developed. A place that recruits the next generation of pediatric experts and pushes the boundaries of what's possible. We're going to challenge ourselves, and we want you to challenge us to be innovative, to be the absolute best in pediatric care, not just in Kentucky, but in the country. And we're going to do it all right here in the Commonwealth. stop watching those commercials about other states and their children's hospital. Right here in the Commonwealth of Kentucky. That ought to get a round of applause. Look, let me be clear. This hospital is not, repeat with me, not replacing our downtown hospital. Hear it again. Not replacing our downtown hospital. It's expanding on it. The way you increase access is not to close things, it's to keep things open and build more. That's how you build access. So, get the talking point right. We're growing, not moving. Now, Norton Children's downtown's here to stay, and we're going to continue to invest in it. It's an important part of our community. And when we talk about access, we put money where our mouth is. And we talk about the entire city needing to be and having a level playing field around access. So that's how we're going to do that. We know access to care remains a challenge, but we also know that where there's a challenge, there's opportunity. And that access problem is throughout our state. We want to make sure that we're able to provide that access, not just for our state, but for the entire region. That's why this new campus is going to serve as a beacon of hope for all 120 counties in Kentucky. By golly, a child in Bowling Green with a complex neurological disorder is going to be able to receive seamless inpatient and outpatient care. The teenager in Louisville battling cancer is going to be able to enroll in cutting-edge clinical trials without needing to travel across the country. That baby from Owensboro that's having heart surgery is going to have it in a brand new medical suite. The kid from Lexington facing a rare diagnosis is going to find out not only expert care exists here, but a team that will walk alongside you with compassion and hope is here as well. We're designing this campus not just as a hospital, but as a village of support, a place with warmth and dignity and world-class amenities that families deserve. It's reimagining what healing can look like. Now, this is our vision, but it belongs to all of us. We want to build with our community's voice at the very center of this place. That's why starting this summer, we're launching our Follow the Balloon campaign. This is going to be a year-long series of listening sessions that will take us to cities and towns, hundreds of miles in every direction. Our team members are going to travel the region in the Just for Kids van you saw parked here today. And our goal is one thing: listen to you. We learned a lot at Norton West Louisville Hospital. If you listen, you get great ideas. And if you listen, people trust you. And if you listen, they'll come visit you when you get it built. So we're going to listen. We're going to connect directly with families, with patients, with educators, with caregivers, with community leaders, because we want to know what matters most to you. What do you think care should feel like? What services are missing today that you'd like to see us include tomorrow? Now, keep this in mind. As we build, we also preserve. You saw today, green space is here, and it's going to remain a vital part of this campus and not just as a backdrop. We think it's a healing element. But what should that look like? How should we do that? How do we make sure this campus is not just medically exceptional, but welcoming and emotionally supportive and truly healing? When we say family-centered care, that's what we mean. Everyone involved. The insights we gather are going to directly shape this project. Can't tell you how appreciative we are of this community. Everyone's been so supportive of our hospitals, and everyone's willing to step up, and we're going to ask you to step up again. Our plans are going to evolve. We're going to need to be doing things that are going to require us to ask the community to step up again. I've asked Lenny Meyer, our Senior Vice President and Chief Development Officer, to begin. Where are you, Lenny?
Right here.
Right here. You're going to see Lenny a lot. She's going to begin to visit you and talk about the importance of the community's investment in this vision. I want to tell you, in my 25 years with this organization, I've seen Norton Children's evolve into things that I never thought possible. We're serving over 215,000 young patients every year. Look, this is a legacy in the making. It's a place where we think science can meet compassion, where breakthroughs can be born, and where every child has a chance to live their best life. For the past few years, you've heard us ask you through a campaign to just imagine. Imagine the possibilities for our children in this community. The future we dream of isn't just a distant possibility. It's something very real that we need to create together. I invite you to reimagine what healthcare for kids can look like right here on this very property. I have a question for you. Are you ready to think even bigger? That's yes. Okay, close your eyes. Imagine a space where healing happens for the youngest patients. A place that just exudes hope and has a heart just for kids. Keep imagining what it means to be bold. Look, let's do this together so the next generation has an even brighter future. Let's imagine. Are you ready to imagine with me? Let's go. Thank you all. I still have those goosebumps, so just bear with me. Well, you know it's important when you have the governor of the Commonwealth with you. And you know, I've introduced the governor so many times through the years, and I always ask people, what do you think of when you think of our governor? And everybody comes up with the same thing. He's always there. He's certainly been there for our state. If you think about becoming governor right before a global pandemic, he was there for Kentucky. He was there for healthcare. He was there for Norton Healthcare. When you think about storms, tornadoes, floods, he's there. He's always there. When you think about somebody who cares about you as a Kentuckian in Washington, he's there. He's there for you. But let's talk about Norton Healthcare. He's always there. Not that long ago, I met with the governor on a cold Saturday morning and asked him for help so that we could build that hospital in West Louisville. And he told me that day that I could count on his support and he would do whatever it took to get it done, and he did. He was there. Well, he was there in November when Corinza Townsend cut that ribbon at Norton West Louisville Hospital. He was there. Just a couple of weeks ago, he was there in the lobby at Norton Children's Hospital when we got the great news of the $1 million grant from the Kentucky Pediatric Research Trust Foundation that will allow us to establish an oncology resource center for families of pediatric patients. He was there. And you know what? He's here today as we once again start off on this. He's been there. He's here today. Governor, I think the only thing I can say is we've got to keep meeting like this. Please join me in welcoming the 63rd governor of the Commonwealth of Kentucky, Andy Beshear.
Thank you all. Good afternoon on this incredible day in the Commonwealth of Kentucky. Yes, we've weathered a lot of storms. Yes, we've been through just about any and all adversity you can imagine. But the next day, every time, we've been announcing that new job, that new opportunity, that new healthcare clinic. The Mother Nature has thrown everything that it could imagine at us, and we haven't let it keep us down. We've kept marching forward together. Today, I'm glad to be here with our Lieutenant Governor, Jacqueline Coleman. And I am thrilled to be here. First, thanking Russ for that kind introduction and for his partnership in facing all that adversity, but also in creating so much opportunity. I believe that healthcare is a basic human right. So on this campus, kids are going to get the world-class care they deserve, the top care that they could find anywhere in the country. Our doctors, our scientists are going to take research and innovation to an entirely new level. And we're going to build one of, if not the largest, pediatric health campuses in the country right here in Jeffersontown. Now, I might get in a little trouble with Russ because he didn't necessarily share a lot of numbers, and I'm going to share a few. See, we've looked at the project. We've seen the projections, and I'm here to tell you that we believe there will be well over 1,000 individuals eventually working on this campus. That makes this the largest jobs announcement thus far this year. So Mayor Pike, to the City Council, congratulations to Jeffersontown, to J-Town. When we look at the projections, and I know there'll be a lot of partners, a lot of groups, a lot of different folks bringing investment, we believe there's going to be well over $1 billion invested on this acreage. So this year's Derby might already be over, but we are still on a heck of a win streak. You think about what's happened in these last 5.5 years, it has been state changing for us. A record $35 billion in new private sector investment, a record 60,500 new jobs. And those jobs and the services they provide are reaching every single part of this state. And this is going to be yet another service that no one will ever have to leave this Commonwealth to secure the very best for their children. I think about bringing health care to all parts of Kentucky because people deserve to be able to see their doctor and a specialist where they live. I think about the fact that we opened 2 pediatric autism centers in Appalachia. And then I think about the fact that last November, Corinza cut that ribbon on Norton West Louisville Hospital. Yes, the first hospital in West Louisville in 150 years, but also that's bringing 350 jobs to those neighborhoods. And one of the things I'm so excited about here is their listening session and bringing in the right type of leaders. I think about Corinza Townsend and what she has brought to that hospital, to its development. She is a force of nature, and we're really grateful for her leadership in this Commonwealth. So now, Norton's back at the starting line, announcing yet another game-changing investment, one that will transform pediatric health care in the Commonwealth. That's because when it comes to protecting our children, Kentuckians don't wait to follow others, we lead. As a parent, I can tell you that no one ever wants to have to take their child to a children's hospital. But when you do, you want the very best. You want peace of mind knowing your family is getting the best care possible. That's what they'll receive on this campus. And you want the relief knowing that you have options, depending on where you live and depending on what treatment your child needs. Now families in this region will have access to not one, but 2 freestanding children's hospitals, Norton Children's downtown and this new facility right here. It'll provide space for additional patients because sadly, we've got more pediatric patients now, and each one of them deserves the very best. It's also going to provide for more specialists, like those treating anxiety and ADHD, heart disease, childhood cancer, and more. That's where Norton is stepping in to meet our children's needs. Just last month, I was with Russ as we helped lead the battle against pediatric cancer. We awarded just under $1 million to Norton Children's Cancer Institute for a new family resource and survivorship center. Folks, cancer is the leading cause of death among our children. And we're losing far too many of them before they ever get the chance to live out their childhood, much less go into adulthood. On top of that, medical debt is the #1 cause of bankruptcy in the country. While we're standing up, some of our leaders in D.C. are also threatening to leave about 16 million Americans without health care coverage. They're trying to cut research that could find the cure for the next child, the treatment for that next family. And let me just say in my Kentucky accent, that just ain't right. But regardless of what D.C. is doing, Kentuckians are doing their part, and we'll do it even if we have to do it ourselves. But you know, when it comes to all this in Kentucky, It's everybody working together. I think about that last budget and securing a record $14 million for research and support to families battling pediatric cancer. And I want to give credit where credit's due. Our Senate President, Robert Stivers, has stood up for cancer research and other research. Thank you very much. Because he and our other legislators got that through, a record amount, more than many parts of the federal government invest in cancer research. I got to sign that appropriation thinking about my friend David Turner Jr. David went to Tully Elementary School, just 10 minutes down the road. We lost him when he was 9 years old to DIPG, which is a form of pediatric brain cancer. He never got to live the life that we have. He never got to live as long as my children have. But he cared so much about others who face this disease, enough to where even when it was hard, even when it was painful, even when he had trouble moving, he showed up event after event, time after time, because, well, I think he knew he might not make it. He wanted that next child to make it, and it to be just a little easier on that next family that had gotten that diagnosis. He believed that no one should ever have to hear that there are no more options, that there is no cure. While the body is mortal, the soul is eternal. And I know that David is looking down on us today, and he's really proud, ready to build a brand new hospital, a one-of-a-kind medical campus right in his backyard. This hospital is going to help. It's going to help kids like David, kids all across Kentucky, kids all across the region. Every American child deserves effective treatments, and you know what? They all deserve a cure that we ought to keep working towards. And right here, doctors and scientists will conduct research to help cure more than 100 child care conditions. This campus of care, the one that together we are going to build here, will show our nation what's possible when we commit to treating the whole family and not just that patient. To all the healthcare heroes out there, doctors, nurses, patients, service representatives, social workers, technicians, custodians, every single person working to make this possible, thank you for making a difference. And while some states turned against you during the pandemic, we stood shoulder to shoulder the whole time to save lives. I also want to thank those of the state who've been working with Norton to get this project started. From the legislative leaders you'll hear from that got important bills through, to our Cabinet for Health and Family Services that made some changes to make this happen. This can be a win for every single part of government, but for every single Kentuckian that might need the very best for their child or their grandchild. I hope that y'all can feel the progress. I hope you can feel the energy. With announcements like this, we're not looking at the same Kentucky anymore. And we're building our new Kentucky home, where opportunity and possibility are available everywhere, where we're providing the very best to each and every one of our families. This campus is going to help make sure every child in our state gets the chance to succeed, whether they live a few minutes away or have to travel here to get that cutting-edge treatment. Scripture tells us that children are a gift from God, and that we have a duty to our God and to each and every child to do our very best for them. I believe that we all have a responsibility to build a better state, not just for ourselves, but for every generation that comes after us, where every child is safe, where every child feels safe, and where every child gets to grow up healthy. I can't wait when we're back here to break ground and then to cut that ribbon. So let's keep building together. Let's keep working to create the bigger and the brighter future that every Kentuckian deserves. Let's keep working for our Kentucky kids and our Kentucky families. Thank you all, and let's get it done.
Thank you so much, Governor. Appreciate you being here today. Now, this is where I get to not necessarily follow the script a little bit. So just bear with me for a second. The Lieutenant Governor's here with us today. Jackie Coleman, she's been at so many of the same things that I just talked about. And I have such an appreciation for her, a teacher, someone who loves children, but I also know she had a birthday this week. And I also know that there's somebody else here whose birthday is today. So I'd like to ask the two of you if you would come forward for us. Lieutenant Governor and Julie, a birthday last week. No, stay here. Stay here. What you get to see is the best bipartisan version of happy birthday ever. Right? Let's go. Happy birthday to you. Happy birthday to you. Happy birthday. We don't know what to say. Happy birthday to you. The governor said I don't mention numbers often, and I'm not going to mention numbers here. We're just going to leave that off. We have fun at Norton, and we're family, so we celebrate your birthday with you. Senator Julie Rocky Adams, she represents Kentucky's District 36. She's been a great supporter of Norton Children's and pediatric health care. She cares about kids. She secured General Assembly support for Norton Children's Center for Safe and Healthy Kids, which has helped hundreds of child abuse victims find healing. That's important work. She always steps up for children, and we're pleased to have her with us today on her birthday. Please join me in welcoming Senator Julie Rocky Adams.
Okay, hi, it is so nice to be here, and thank you for that very kind introduction, Russ. And the biggest excitement for me is that we are celebrating this incredible investment right here in Senate District 36, which is such a treat for me to represent this area and to represent Norton Healthcare. So as Russ said, today is my birthday. So I read my horoscope today, and it was weirdly poignant for this event. So here's what it said. It said, quote, "Instincts are your secret talent that has you choosing well, and your work makes you strong and useful," end quote. I have chosen well over the years in my efforts to always partner with Norton, and our work together has always been useful and purposeful. So thank you. Whether it's continuing our shared commitment to fight the scourge of child abuse and neglect, or promoting access to pediatric health care, I am here today as a proud advocate for the mission of Norton Children's, and especially for the development of this world-class pediatric hospital sitting right here on more than 150 acres in Senate District 36. Norton Children's has a long, well-established reputation of providing high-quality care to the children throughout this state, and this new state-of-the-art children's hospital again proves their commitment to serving our children and our families of today and the family and children's of our future generations. I am honored to pledge my ongoing commitment to supporting this new world-class pediatric hospital and the mission of Norton Children's while I'm in Frankfurt. It is special to see how the General Assembly's work has directly contributed to today's event. I was happy to work with Norton Children's during the 2024 legislative session to incorporate a provision into Senate Bill 280 that supported additional funding and resources for teaching hospitals and pediatrics. As the chair of the Senate of the newly created Medicaid Oversight and Advisory Services Committee and a longstanding member of the Health Services Committee, I commit to you that I will continue to be your advocate in Frankfurt for anything that you need. Kentucky does face many challenges when it comes to health measures and outcomes, and children's health and access to pediatric care is among those challenges. But today's announcement is not just about new construction, it's about building capacity, building trust, and building a healthier Kentucky from the ground up. So I'm honored to be here today to participate in this with you all. And I'll echo the last two speakers. Let's go.
Thank you so much. So, as a representative for House District 31, Representative Susan Tyler Witten has championed many causes to improve lives, not only in Jefferson County, but throughout the Commonwealth. She's a leader focused on results and getting things done. And I know, let's go, right? Please join me in welcoming Susan Tyler Witten.
Good afternoon. Thanks you so much for this opportunity to be here today and to take part in today's exciting announcement as we celebrate one of the largest investments in pediatric care in the history of our Commonwealth. Norton's has long been an invaluable community partner, serving generations of families in Louisville and across Kentucky and our nation for more than a century. Today, we celebrate a new chapter in the Norton's legacy. A chapter defined by a world-class pediatric facility designed to meet the next generation of healthcare demands. This new facility will strengthen our healthcare infrastructure, attracting the best and the brightest in pediatric medicine. It will serve as a beacon to researchers doing groundbreaking work across the country and the world. But this state-of-the-art facility isn't just going to be a hospital. It embodies hope, innovation, and an unwavering promise to care for Kentucky's children and families with the best medical services available. Its arrival will create new jobs, attract top healthcare professionals, and spark additional economic growth throughout this district, the city of Louisville, and the entire Commonwealth of Kentucky. Our children deserve a world-class healthcare facility, and our community deserves the security of knowing that in times of need, Norton Children's Hospital is here to provide compassion and expert care. We appreciate the vision of Norton Healthcare and their commitment to this community. Together, we are not only investing in our most precious resource, our children, but also in the future of our Commonwealth. I stand committed to ensuring that this project becomes a cornerstone of progress for all of us. So thank you, Norton's Hospital, for ensuring a healthier, brighter future for this community, this city, and the great Commonwealth of Kentucky. Thank you.
Thank you very much. So I was at a GLI dinner a couple of years ago, standing, minding my own business, and this tornado of a woman comes and runs into me and says, "I'm Mayor Pike, and we want Norton Healthcare in J-Town." Little did she know, we were on our way. Mayor Carol Pike's first female mayor in J-Town's 225-year history. She's been so instrumental in the city's growth. She continues to work to make J-Town a place where folks want to be. She's worked hard to create that environment, and that's one of the reasons why we're here. So please join me in welcoming to her own home, Mayor Carol Pike.
Wow. I am so excited about being here today. I want to say good afternoon, but everybody else has already said good afternoon. I just want to thank you all for being here. First of all, I'd like to say that Jeffersontown has been looking forward to this for a long time. We were delighted and appreciate that a caring community as Norton Children's has chosen our city to create a village of care for the children in our region. The families of our local communities will no longer have to go to Indianapolis, Nashville, or Cincinnati to obtain the care that their children deserve. They can join us here, right here in Jeffersontown, where we will embrace them as neighbors and, yes, our friends, because everybody here is our friends. And I think Russ has gotten to know that. I have been involved in the development of Jeffersontown since I joined the City Council in 1982. That's right. I said 1982. 44 and a half years ago, I became a city council person for the city of Jeffersontown. When I was elected mayor in 2022, it was my intention to seek out areas of expansion for such businesses and facilities as Norton Children represent and define. When I went to that GLI meeting, someone said, "That man is Russell Cox." And I said, "Oh, I want to meet him." So nobody introduced me, so I just went over and introduced myself. And I said, "Russ, I'm Carol Pike, Mayor of J-Town, and you have a competitor out there that's showing you up." And I said, "And your name's not anywhere, but their name's everywhere." And he said to me, "Find me 100 acres and I'll move there." And I said, "You told the wrong person that." So I come back and I get on the phone, and I knew the people that owned this land, and I called her up, and yes, they wanted to sell. Okay, who's the most prominent person to buy this land? Was Hollenbach Oakley. Called him up. So we have one phone call going in one room and another phone call in another room, and throughout all the meetings, we joined them in marriage, and it finally happened. Thank you, Russ. You know, if there is any legacy a government official can hope to leave, it's a place dedicated to caring for children. While it is my hope to continue for a few more years, I know that this will be my proudest accomplishment, helping to bring Norton Children to Jeffersontown and our community at large. Thanks for everyone for coming today, and you're welcome anytime. Thank you.
Got to be careful at those dinners. Wait till that competitor gets a load of this. It's always good to have a mayor in the city of Louisville that's an entrepreneur that understands big thinking. I've never gone to Mayor Greenberg with an idea where he said, "Oh, I don't know." He said, "Let's do it. Let's figure out a way." This is a big deal. Those were the words he said to me the day that the article ran that we had bought this property. This is a big deal. And he encouraged me to think big, and that's what we've done. It's good to have also somebody who's a great husband, a great father, and believes thinking big is the right thing to do. He's focused on the right things, folks, and he's focused on making Louisville a great place. Please join me in welcoming our mayor, Fred Greenberg. Just big enough? Big enough.
Yes, Russ, this is big enough, and let's get it done. It is great to be here to celebrate with you, all of your colleagues at Norton Healthcare, and folks from around the community and state. This is another example of the positive momentum that is sweeping our city right now. And I cannot think of another leader in our city like Russ Cox and his team at Norton Healthcare that is contributing to the positive momentum Louisville and Jefferson County is seeing right now. You've heard it, but just think about it. Just think about it. Literally from west to east, Norton is making a positive impact in people's lives. I'll say it for the third time today. They just opened the first hospital in West Louisville in over 150 years. But also the middle of our city, in the heart of our city, right in the heart of downtown. Norton, as you heard, is growing, not moving, and they continue to be committed to the entire LouMed district, working together with the other partners in LouMed, working in partnership with the city, with the state representatives and senators that we have here today, which have provided some incredible funding so that Norton and others that in the LouMed area are truly going to continue to make that a world-class medical research and educational district. And now as we move east, what Norton is doing once again in the eastern part of our city, of our county, with this amazing investment. It is just so wonderful to have companies like Norton that are doing so much. They are doing so much to serve their patients, to support their employees, and to give back to this city in so many incredible ways. So Russ, to you and your entire team, thank you. Congratulations. You all are saving lives, and you are helping making our city safer, stronger, and healthier every day. Let's keep this positive momentum going. Let's continue to think big, and let's get it done.
And congratulations on the graduation, right? One off the payroll? There you go. We would not be here today talking about the things we're talking about if we didn't have a great partner like the University of Louisville School of Medicine Department of Pediatrics. It's just that easy. It doesn't happen without a great partnership. But great partnerships happen because of great people, because organizations can be fickle. People are what we count on. Dr. Bumpus has always been someone we can count on. I'm so glad that at this point in time, he's leading, because I know at his heart, what happens for the youngest patients in our region is the most important thing to him. He's the Dean and Executive Vice President for Health Affairs at the University of Louisville School of Medicine, and he has a great vision for that university to make it the best, to make it number one. We share that goal. We want to help him recruit world-class talent to take care of our children. We want to help him train and retain. And if you saw the picture over there about this campus, we have an academic building. I told Dr. Bumpus as he walked in today, my hope is that both of our feet were standing in a place where that academic building was, right next to Norton Children's Hospital on this campus. We will know we have arrived when the proximal location of where education is taking place is the same place where care is being given in a new and contemporary way. So join me in welcoming Dr. Bumpus.
Thank you very much, Russ. I'm going to say a new bold statement if I can. I don't think that any place on this planet burns or looms brighter right now than Jeffersontown, Kentucky. We burn bright today, and we ought to be proud of that. I bring greetings from President Jerry Bradley at the University of Louisville, the faculty, the staff, the students, who are also known as our future pediatricians and specialists of the University of Louisville. I particularly like to thank the governor and lieutenant governor, president of the Senate Stivers, and all of our legislatures, representatives of our federal legislative delegation, Mayors Greenberg and Pike, for their strident commitment to help us improve the health and lives of Kentucky's children. Additionally, my deepest thanks to Russ Cox, Dr. Steve Hester from Norton Healthcare, and particularly Dr. Kim Boland right here, who's chair of the Department of Pediatrics. Another luminary in that is Diane Chardino. I don't know where you are, Diane, but Diane is our Chief Executive Officer for the hospital. Please stand up, Diane. Please stand up. We go in a room together, and we go in a room with a singular vision, and we go in the room together, and we're united. Let me tell you a little bit about this and why it's so important to us and so important to the Commonwealth. This is noble work. This is noble work. And one of our principles as a cardinal principle at the University of Louisville is the N, and the N stands for noble work. And the C of the cardinal principle stands for, these are my two favorite letters, so I always call them out, means that we are a community of care. Today represents a celebration with and for the children and families of the Commonwealth of Kentucky, whom we are proud to serve. As much as they celebrate us, we are here to serve and celebrate them. So this is theirs. The longstanding collaboration and now pediatric affiliation between Norton Healthcare and the University of Louisville, its health science campus, and the School of Medicine represents a proposition that is dedicated to our children and their parents, past, present, and future. We not only are committed to the most advanced, compassionate, and best care of Kentucky's children, but we are committed to educating the physician, nursing, public health, and many other healthcare professionals and researchers that will serve our children and the children of the region and their children and their children's children. In the last 6 years, since our enhanced affiliation agreement for the pediatric healthcare and education began, we have grown the pediatric network by over 200 providers, 200, and added over 80 faculty members to the Pediatric Academic Medical Center. We have had substantial expansions in critical programs such as congenital heart disease, bone marrow transplantation, and cellular therapies, and state-of-the-art diabetes management, earning us a record, listen, 7 specialties in pediatrics that are ranked by U.S. News and World Report. We have grown the research mission and increased federal funding 3-fold, jumping from the status of being 81 in national funding rankings for pediatric hospitals to that of 58. We were the single greatest advancing pediatric academic entity in the United States this year. We've created multiple new educational programs, including a fellowship in pediatric cardiology, pediatric hospital medicine, and we are moving forward with 3 new programs for accreditation, and they're just amazingly impactful. We've spoken to the need for mental health and behavioral health providers. We're going to have a fellowship in child psychiatry, adult congenital heart disease, and pediatric GI disease. Thanks to Russ and others at Norton Healthcare with their vision, we have hired transformative new leaders working at the cutting edge of advanced treatment in childhood cancer, GI disease, eye disease, and many other areas. Again, this day represents a celebrating with and for the health of our children and their families in the Commonwealth today and well into tomorrow. Thank you, and it's a privilege to be part of this.
Thank you so much. We look forward to great things. 7 going up. Just bear with me a second. I was born in a small town, Pineville, Kentucky. There's not many people who know where Pineville, Kentucky is, but our next speaker, he knows exactly where Pineville, Kentucky is. I never will forget, 6 years ago, a conversation I had with Senate President Robert Stivers about the community hospital in Pineville, Kentucky, and the duress, the trouble that it was in. I've never seen anyone become more passionate about the need for access to healthcare services. I walked away from that conversation saying we all need to adopt that same passion about access for wherever we serve, because this guy believes if we're going to be successful on this site, if we're going to be successful as an organization, we need this entire state viewing this facility as a wonderful choice for access to quality care. Senator Stivers, what can you say about him? Leadership exudes from him. He has absolutely taken the charge against cancer single-handedly. I don't know that there's anybody in our state that has a bigger passion to make certain that things change statistically as it relates to the health statistics in our state. Again, I always want to have the passion this man has. Please join me in welcoming Senate President Robert Stivers.
Yes, Russ, I know where Pineville, Kentucky is, 20 minutes from my house. So let me say this. I want to thank everybody for coming out. And I want to say, from my perspective, I'm a little bit of an outsider. Clay County, a little bit of ways, Manchester from Pineville. But what I see here and what I want to describe as being able to come from the outside to the inside is what I see as a lot of energy, Mayor. And I, as the governor did, let's say this, the mayor reached out to a lot of us. A lot of the legislators are here. We have both Nemeses here, Jason and Mike. Mike's in the Senate, so we have the best Nemes. John Hogsden, Tina Bojanowski. I see David Yates, see several of this group here. This is one thing that we come together in quite a collaborative and bipartisan way. And it's to look at the city of Louisville over the last few years, and let me go through some things. You think about $400 million we've appropriated to the Fair and Exposition Center to change it. $100 million with the mayor. Just had an announcement last week to renovate the Louisville Gardens, a C3 campus to take care of the homeless, those people who have substance use disorder. Talk about the millions of dollars we put into the West End, the Louisville Waterfront Authority, the Botanical Gardens, not to mention the money we put in the University of Louisville, getting close to $500 million of investment. There's an energy that I see when I come in because I'm on the outside that I don't know if people in Louisville see, but I see it and it's happening. But there is nothing any more energetic than this announcement today because it is for our children. As I drove up here, and I'm not one to generally have prepared remarks, the trooper that brings me, sometimes I have to get protected from Julie. He was asking what this was about. And I said, it's an announcement that Norton's is expanding, specifically focused on childhood care. His response to me, and I hope he doesn't mind me saying this, he said, it's needed. It's why. My child spent 150 days in a NICU. That was today. Within the next 24 hours, 12 and 13 will come into my life. And people are saying, well, what's 12 and 13? It's going to be a couple of 33-week-old twin grandchildren of mine and my wife's. And hopefully they don't need the services, but if they do, I think about how great would it be not to think about going to Memphis or Cincinnati or Boston, that we can come here for those types of services that we just don't have right now, but we'll have with a partnership between Norton's and U of L and being collaborators instead of competitors. That's what we need to do for the children that are here and the children that are coming here. And that's what this day is about. And thank you to the two parties that are making it happen. God bless and have a great day.
Pass the plate. Pass the plate. Thank you so much. We absolutely agree. Now you're going to get to see why. I want to introduce you to somebody. She's getting a little restless, and it's time. I want to talk about Lily. At 18 months old, Lily was diagnosed with atrial septal defect, a hole in her heart. Earlier this year, the team at Norton Children's Heart Institute repaired the defect, which required stopping Lily's heart for 30 minutes. This weekend, she'll celebrate her second birthday. Her parents, Lauren Cherry Newcomb and her husband, Paul, are excited about this second birthday, as you can imagine. But they also are grateful for the care Lily received and are big supporters of Norton Children's Hospital. I want you to hear from them. So please join me in welcoming this family.
Thank you, Russ. I'm here today, first and foremost, as Lily's mom. From the very beginning of Lily's life, Norton Children's has been part of our story. Even before her diagnosis, we received incredible care through her Norton Pediatrics team, partners who supported not just Lily's growth and milestones, but also Paul and me as new parents navigating those early years. In fact, it was her pediatrician, Dr. Bowling, love her, who was the first to recognize early signs that something more could be at play, and whose attentiveness ultimately led us to the specialist who confirmed Lily's diagnosis. At 18 months old, Lily was diagnosed with a congenital heart defect, a hole in her heart that would require open heart surgery. It's the kind of news no parents expect to hear. And like any parents, we researched every option, even looking at hospitals outside Kentucky. Dr. Bolin will tell you we had a couple combos over bourbon. But Norton Children stood apart. It offered not only world-class medical expertise, but holistic care that supported Lily and our entire family every step of the way. Once we made that decision, Norton Children's gave us exactly what we needed. Not just reassurance, but a plan, a path forward, and a team who stood beside us through it all. You wanna come? Yeah. She's a Gemini, you know. From the moment we walked through the doors for specialty care, we were surrounded by experts who guided us through every moment and held our hands through every fear. During Lily's hospital stay, it was often the small moments that carried us through. We built routines. We visited the book cart. We stopped at the nurse's station to say hi. We walked to the toy room. And Duncan, the facility dog, brought smiles on the toughest days. And in a moment I'll never forget, when it was finally time to hold Lily for the first time after her surgery, it was my own sorority sister, someone I hadn't seen in a decade, who placed Lily in my arms. That moment was a gift, a reminder of the compassion and humanity inside hospital walls. Beyond our room, we felt the strength of Norton Children's community, brave hearts families who brought snacks, encouragement, and reminders that we were not walking this path alone. You want to say something? Okay. Thanks to the care Lily received, her surgery earlier this year was a success. And of course, on Sunday, on Father's Day, we will be celebrating her second birthday. Her journey still continues, and our journey still continues. Like many children who might have complex conditions, Lily is closely followed by her Norton Children's cardiology team and remains on medication to manage pulmonary hypertension. I was going to add a joke here about what that medication is, but I'll let you Google it. That ongoing care gives us confidence and peace of mind, knowing she's surrounded by experts who know her story and walk this path with us. While we're fortunate to have this care close to home, many Kentucky families face the added burden of traveling hours away, leaving behind work, siblings, and support systems just to access this specialized care. That's why today's announcement is so meaningful, right? Growing pediatric care right here means more children can receive world-class care just like Lily did close to home. It allows parents to focus on being parents, siblings stay together, and children like Lily receive life-changing care, not just during a crisis, but throughout their journey, surrounded by the people who love them most. On behalf of my family, on behalf of Lily, and on behalf of so many others, I'm deeply grateful for Norton Children's vision and commitment. This isn't just an investment in a new hospital, it's an investment in Kentucky families and brighter futures for every child who walks through those doors. Thank you.
There's always somebody wanting to take the microphone. It never fails. Never fails. One of the things that makes Norton Children's Hospital, one of the things that makes Norton Healthcare special, our physicians bring spiritual care. Typically, we'd have a chaplain come and do a blessing on this land, a blessing on this day. Today, we thought we have so many of our providers, our physicians, who bring that spirituality that maybe it's best that we change it up. So let me introduce you to Dr. Aaron Calhoun. He's an attending physician in the Just for Kids Critical Care Center at Norton Children's Hospital and Critical Care Division Chief. He's also an internationally recognized expert in simulation-based medical training. In his role, Dr. Calhoun has saved countless lives and served families in their most difficult circumstances. And he's going to bring the blessing. Please join me in welcoming Dr. Calhoun.
I'd just like to thank each of you here on behalf of all the providers that work throughout the Norton's enterprise, throughout Norton's pediatric care, for the honor of being here and on their behalf to able to ask for this blessing of God on this site, on the providers themselves, and on the children that we're going to care for. So let us pray. Almighty God, you are the source of all life, all goodness, all mercy, and all healing. We thank you for your everlasting love toward us, whom you have made, and for the time, knowledge, and resources that you have given us to do your work here in Louisville. Father, you know the needs of the children of this city and state better than we ever could. And you have taught us to lovingly care for and attend to them, for theirs is the kingdom of heaven. We now come to you humbly, asking for your blessing as we seek to meet those needs with this new children's hospital. We ask that you guide the planning and construction teams with your wisdom as they seek to design an environment conducive to healing. We ask for your ongoing provision as we mobilize the resources of our organization and community to bring this project to fruition. We ask that you instill a spirit of generosity in the benefactors who may contribute to this hospital, giving them a clear vision of the ways in which their gifts will promote the flourishing of our children. We ask for your presence and your power to be with all those providers who will care for the patients within its walls, and that the knowledge and skill of the great physician would be ever in their minds and hands. But most of all, we ask for your healing grace to be on the children we'll serve in this place in the years to follow. We ask that they may be freed from their illnesses, that they may be restored in mind, body, and spirit, and that through the work done here, they may be raised up to full life and health again. Father, please receive the work of our hands in this place. And if it be your will, bless that work to the good of our community and to the honor of your name. All this we ask through Jesus Christ, your Son, our Lord, who lives and reigns with you in the unity of the Holy Spirit, one God, forever and ever. Amen.
I want that guy taking care of my kids. I don't know about you. That was outstanding. Thank you so much. One more thing, two more things maybe. We're going to put a QR code up here. We've thrown a lot of pictures at you. We've thrown a lot of information at you. We want to see you taking a snapshot of that QR code. It'll take you right to the information that you need about this. Please do that. We need everyone involved in this. Two people I want to thank within Norton Healthcare before we get out of here. One, Dr. Steve Hester has just tirelessly advocated to get this done from a regulatory standpoint. We asked him to be a doctor and do a lot of other things. We've asked him to also take on advocacy, and he's done a just unbelievably great job. So we're not here. We don't have the approvals that we need without him. So thank you, Dr. Hester, wherever you are. Thank you. I want to also thank Renee Murphy in our marketing communications. This whole thing all falls to her and her team. Please know how much we appreciate you being here today. Please know how excited we are. Please know how we can't wait to get back here and break that dirt and cut that ribbon. Thank you once again.
Do you all need any slide interviews or anything? Plenty of talking happening.